And why do we care about fertility in these women? This is because nowadays there's a trend towards delay in childbearing. And if you look at this curve, over the years, you can see that between 1970 and 2012, more women are delaying childbearing, their first childbirth, until the age of 40. And the proportion of women in the United States that are delaying childbearing till the age of 35 to 39 has actually increased to about 10% over that same time period. And we all know that the consequences of infertility are usually psychosocial, with grief, emotional distress, and a lot of other family and social issues. However, the peak incidence of cancer of the cervix is also around this same age range. And the question is, how can you preserve fertility without jeopardizing oncologic outcome? So let's review, actually I don't need to spend a lot of time on the standard therapies for cancer of the cervix, especially after listening to those previous talks. So the standard management depends, the standard surgical management depends on the stage, as you have heard in the previous talks. With patients where disease is confined to the cervix, stage 1 disease, can usually be adequately treated with cone biopsy, cervical conization, or a simple extrafascial hysterectomy. Patients who belong to these categories from stage 1B1 to 2A are generally treated with radical surgery, and patients in the advanced stages are generally treated with chemoradiation or some form of neoadjuvant chemotherapy followed by surgery, as previously outlined. So if you want to preserve fertility, how do you modify this traditional scheme? And the way to do that is to begin to think of what kind of procedures are going to replace the radical surgery. So for cervical conization, there's really nothing, nothing is going to change. A patient that requires cervical conization, regardless of age, could simply be treated in that fashion, and fertility will be spared. But in the case of patients requiring simple hysterectomy, one can now begin to change the approach by considering a simple trachelectomy, or a patient that requires a radical hysterectomy could be considered for radical trachelectomy. So one of the critical issues in dealing with these patients is really to make sure the patient understands and is able to consent to the treatment, with the full understanding that even when you elect a conservative procedure such as a trachelectomy, at the time of surgery, the final decision to proceed will be made at the time of surgery, and such patients may still require radical surgery. It's important for the patient to truly desire future pregnancy. The age is also important. Patient must be less than 40 to 45 years. And at this point, it's typically confined to patients who have stages 1A1 to 1B1 disease. All histologies, squamous adenocarcinoma or squamous histology could be considered for fertility sparing surgery, and there should be no evidence of regional or distant spread. There should be no other contraindications to surgery.